Shameet, I'm so glad that you're here and I get to hear what you're building at Vheda Health.
Yeah, I'm excited to be here. It's been a long time since I've been in Miami, so it's good to be back.
So it's my understanding that you are really leveraging technology to help folks who are on Medicaid and Medicare, a population that's been challenging for a lot of people. So tell me about that work.
Yeah, so we founded the company in 2013, and our mission is very simple, which is to empower people with chronic conditions to live their best life. And so, for Medicaid and Medicare Advantage, what we do is we deliver an 84% member compliance rate and save insurers, who are our customer, money by providing these enrollees access to iPhones.
Break down that 84% compliance rate. Why? Kind of what that means and why that's a big deal, that number.
Yeah, so it's a big deal because with Medicaid and Medicare Advantage, these are among the top two hardest populations to activate. And on programs that we have deployed across our health insurers, 84% of them are using their core assigned remote monitoring device on a monthly basis. So I'll break it down for you, right? So if you're a diabetic, you're using that glucometer. If you are a patient that has congestive heart failure, you're using that oxygen meter or that weight scale. And our definition of compliance is using those devices actively 2 to 3 times per week, and 84% of them are doing that.
Okay, now connect the dots for me from compliance. Okay, I use the glucometer and the weight scale, and outcomes.
Yep. So we're a outcomes-driven organization. So in addition to the compliance rate, what we're really focused on is how do we lower the cost for our members at our health plans. And so we just did we have done a deployment in various states. Our most recent one in the state of Illinois with a multinational Medicaid plan. And there, what we saw from an ROI perspective is that for every dollar that they invested in our program, they got 4 back.
Okay.
And this was after the cost of our program was taken into account.
How does that ROI come back to them?
So that ROI comes back to them, in medical savings. So reducing the professional and the facility claims cost per member per year.
Okay. So let's say you've got a type 2 diabetic who's being cared for with medications, glucometer, or type 1 diabetic, and because of your technology, you're able to keep them out of the hospital. And that's what lowers the cost? Yeah,
so there are 2 primary drivers that allow us to achieve the medical savings that we do. The first is ER reductions. Okay. So the average ER reduction for members who participate in our program is about 40%, which is quite strong. And then that's coupled with reductions in inpatient admissions, which is what you're saying. So that hovers around between 30 to 40% per member per year.
Okay, so we've talked about your mission, your vision, and we talked about your outcomes. So what is the actual product?
Yeah, so
how do you do it?
So the way that we do it is think about our program as, well, first of all, we're focused on simplicity. How do we provide the most simple experience for all of our members, which is going to translate into the highest compliance rate? And I think that's one of the most unique things that we do at our company, which has allowed us to activate 7 times more Medicaid members than your next best solution option, and then getting them to use that remote monitoring device for a consistent period of time, which translates into that desired health outcome. So what makes up our solution is a combination of the human touch and the technology, right? So as I mentioned earlier, all of our members receive access to an iPhone. That iPhone comes with a talk, text, and data package, which is focused on increasing activation rates for our members. And then we preload that phone with hotkeys, which give them access to our mobile app, the health plan's mobile app, along with other special purpose apps. So let's say, Logan, you have, let's use your use case of a type 2 diabetic. We're gonna give you access to your care manager, your provider, and then our tech support. All focused and available on that phone. And then we'll also provide you with prepared remote monitoring devices based off of the condition. So you'll receive a glucometer, a weight scale, and a blood pressure cuff. And so if you don't have to pair those devices, that already takes one element of the compliance journey out of the equation for you. You can focus that time managing your condition.
Yeah. What I'm hearing you say is the importance of simplicity. To get a phone that has the button just ready to go, just the the weight scale is preloaded. The phone number for your coach is preloaded. It's just simplicity.
It is. It's all about simplicity. So that's one of the things that we really strive. And I think a lot of, if you take a look at the industry as a whole, that's what the industry is missing. Everyone wants to throw technology and expect the user, the member, the patient to adopt it. It just doesn't work. It doesn't work. And so what you need to do is you need to take a member-centric approach and really focus on an experience where the member doesn't have to do anything, right? If you can remove all of those steps, such as preparing devices, ensuring that they have access to all of their care coordination and provider phone numbers, you've taken them one step closer to achieving that 84% compliance rate.
That must give you an interesting perspective on this event. Here we're at a health innovation event. You're using important health technology like Bluetooth weight scales, but really your innovation is how you roll it out and creating that simplicity and the network around it. Do you feel like that's a lesson that other innovators need to apply? Just understanding how a technology is used and simplifying it?
Oh yeah, I think simplicity is the name of the game, and I'll go back to my comment earlier. I think there's a lot of solutions, or frankly, what I like to call like a lot of noise, where a lot of these companies haven't figured that piece out. Is that their whole focus is on how do I get as many devices into the members' hands, and hopefully they're going to use it. But you can't just hope, especially with a population such as Medicaid, and that's why we chose this population. This is a population that, frankly, they make up 1 in 4 Americans in the U.S., so it's quite large. They have access to care challenges, and then it's very difficult for them to manage and get a hold of them. And so that's why we started on this population, because if you can figure out how to activate this Medicaid population, what you've earned the right to do is to help them better manage their health. And ultimately, you want to help them live their best life, which is what our mission is at the end of the day.
Last question. Tell me about a patient that inspires you because your platform was able to help them do just that.
Oh yeah, so most recently we did a deployment, and that deployment was focused on hypertensive and maternity members. So as you know, we offer a platform solution that allows us to address multiple comorbidities, and we did a testimonial video for our members, and that member, we were able to get her to full-term pregnancy. But what she loved most was the live support that she was receiving through our program. So every time she would step on the scale or check her blood pressure, if we would measure that, and then we would communicate to her through a red frowny face if that value wasn't right, and that would then lead to a live outreach from one of our health service nurses who works with them to just ensure that they're feeling okay, they don't need to go to the ER or anything. And ultimately, it gave her peace of mind. And that's ultimately what we want to provide, to this population, just because this is a population that really, really, really needs it. And, they don't get the attention that they deserve. And this is a population that really needs it.
Awesome. Shameet, thank you for taking the time with me.
Sure.
Thank you for pushing hard to help this vulnerable population. And I wish you the best this year.
All right. Hey, thank you, Logan.
All right.